Welcome to IRG's Sports Medicine Update. I'm Tom Hutler along with Shannon O'Kelly, physical therapist and president of IRG Physical and Hand Therapy. And our guests, Dr. Eric Brand and Dr. Kevin Berry from Rehabilitation Options of Issaquah.
Dr. Berry, Dr. Brand, welcome. Thanks for coming in.
Thank you for having us.
It's a pleasure to be here.
Why don't you both tell us about your practice? You're both physiatrists, and tell us about your education, interest, and the type of patients maybe each of you see in your practice.
Well, we're both medical doctors, and we're part of a group called Rehabilitation Options of Issaquah, and we focus on rehabilitation. Physiatry is a field that many people don't know or understand very well, but it's actually a process where we really look at the whole patient in terms of how they move, how they work, and other forms of pathology that we can hopefully treat with a variety of things, from physical therapy and massage to medications.
So, Dr. Brand, physiatry, physical medicine rehab specialist, really you emphasize treating the musculoskeletal system, all types of injuries. And is there a focus in your practice from a sports medicine population, young athletes, or any athletes?
Really, we treat active individuals of all ages from 10 and up, basically people that want to be more active and more functional in their daily lives, or people who want to use exercise as a primary form of medicine.
Perfect. I'm going to give each of you opportunities to talk because we're interviewing both of you together because we're going to talk about a situation or a diagnosis that frustrates a lot of people. And I'm sure as practitioners, you see a lot of, I know as a physical therapist, I've dealt with a lot of tendinitis and a lot of overuse type injuries. Let's talk about tendinitis, and maybe even more importantly in today's world, we're talking about tendinitis, and then also we're talking about a condition called tendinopathy. So let's talk about the two.
So for a long time, we thought that a lot of chronic problems with tendons had to do with tendinitis. And more, what we're discovering is when we do studies of tissue that we thought was chronic tendinitis, what we find is actually there are no inflammatory cells. Now, the term itis means inflammation. So when you talk about tendinitis, that literally means inflammation of a tendon. But if there's no inflammatory cells, then what are we treating? So this has really brought about a paradigm shift within medicine where we used to give anti-inflammatory or non-steroidal anti-inflammatory drugs for a lot of problems. And this may help temporarily calm down inflammation causing pain, but there's actually growing evidence that this may actually truncate the healing inflammation that makes the tissue repair in the long run. So more and more, going through this paradigm shift, what we're doing now is getting away from the injection of steroids, even getting away from the use of non-steroidal anti-inflammatory drugs like Aleve, and getting more into things that actually stimulate healing inflammation. We've been doing this traditionally through the ages with practices like cupping and coining and other traditional practices that relied on healing inflammation. And now what we're discovering now is those traditional practices were traditional for a reason, and that's because they work to some degree. So now what we're doing is implementing things such as platelet-rich plasma, or even injection of prolotherapy, which can be a form of sugar water injection, other techniques like Graston technique or A-stim, or other ways to basically stimulate healing inflammation to ensure that you not just get back to the field as quick as possible, but in the most solid way possible.
Interesting stuff, because a lot of research is showing just what you talked about here is you can have a soreness in your tendon, but when you do and look at the tissue underneath the slide, there's not inflamed cells. What's going on there? Then how come the tendon's bothersome, and why do we call it a tendinopathy? And what's the difference between tendinopathy and tendinitis, just to clarify this?
So tendinitis would indicate that there is a lot of inflammation in the tendon, cells from your immune system attacking the tendon. What we're seeing more and more is just that the tendon doesn't look healthy. It tries to repair itself, but it doesn't lay down healthy tissue. So helps to explain why we've had so much trouble treating chronic tendinopathy for so long, in part because we're trying to treat inflammation that may not be there.
And the body has a particular response, a very specific response to trauma or injury, and sometimes that your body's response kind of creates the problem in a way, or creates the pain or the inflammation or irritation. Tell us what your body's trying to do from a reconstruction project here on an injured tendon.
Well, part of the issue with tendons is that their blood supply is not as great as some other parts of the body. So when we try to heal a tendon, we don't have enough of the proper building blocks to really build it healthy. So one of the things that we've been using more and more at Rehabilitation Options of Issaquah is something called platelet-rich plasma. So what we do is we actually use the body's own cells to stimulate that healing response. We actually draw a person's blood and we put it through a specialized device called a centrifuge, where we actually concentrate the platelets, which are the cells that your body sends to injured tissue. And using that, we can hopefully stimulate the body to lay down healthy tissue so that the patient can recover without having this become a chronic or prolonged condition.
Essentially, your body is built to repair, and it's built to repair itself. So when you injure your tissue or create inflammation, that inflammatory process that is going on is your body's response to repair it. And what you guys are doing is taking those repairing cells and basically enhancing them, or just maybe concentrating them and then injecting in that tendon to promote the healing process.
We're trying to jumpstart the process so that it goes faster and is more effective. And we use the body's own cells to do that, hopefully because it's the most effective way.
Dr. Brown, what is the actual procedure? I mean, the patient comes in, and take us from the time that you identify a patient that might be a good candidate for PRP. Tell us what the patient is going to experience.
So after we've identified a patient who's a good candidate for platelet-rich plasma, using musculoskeletal ultrasound to make a precise anatomic diagnosis, we'll bring them into the clinic, usually for a 1-hour appointment. The first half hour is spent drawing the blood, putting it in the centrifuge, and preparing the solution, as well as answering any last-minute questions. The second half hour of the appointment will be spent in our musculoskeletal ultrasound room, where we specifically target the tissue of interest and will put the patient on a table, numb up the area of interest, or perhaps even do a nerve block to make sure it's as painless as possible. And the patient can even sometimes watch on the screen to see exactly where the needle and the treatment medicine is going.
Yeah, I mean, I think it's important. Accuracy is huge when you're injecting these areas of injury, and you're talking about ultrasound guidance. Explain that as much as you can on radio, what that means, because you're talking about on the screen and how that works.
I would say most people are probably most familiar with ultrasound from looking at babies. It's the same technology. We've just used it to be able to better look at structures from a musculoskeletal standpoint. So we can see muscles, tendons, bursas, all different structures that can sometimes cause pain. So using this ultrasound machine, we can get that same gray picture that people are familiar with when they are going through a pregnancy, but we use it to identify a different set of structures.
And it allows you, from an injection standpoint, to accurately inject this PRP solution into the area where it's needed.
Exactly. Yes.
I think it's important also for our listeners. I mean, you're basically taking the patient's tissue blood and spinning it down to get platelets. There's no other medication in there. I mean, you're not putting any steroid in there or any other anti-inflammatory medication. This is just 100% the patient's tissue.
With the exception of a little bit of numbing medication to make the process more tolerable, that's all that's there, is basically platelets and your own blood plasma.
Can you tell us how your results are and kind of areas that you're finding this really works well, types of tendinitis, body areas, maybe injuries?
The area where we've really seen the strongest literature and the strongest response in clinic is really in the lateral epicondyle of the elbow, or the classic tennis elbow. We've had tremendous response in this area of the body, but we also use it in the Achilles tendon, the plantar fascia, the anterior knee, such as jumper's knee, golfer's elbow, which is the inside of the elbow, tennis elbow, which is the outside of the elbow. We've really seen a good response in any of these tissues that are demonstrating tendinosis.
And how many injections? Is it a one-time deal, or do you have to come back multiple times, or is it based on the area of inflammation and how long the inflammation's been going on?
Like anything that's very patient dependent, many patients are getting a really great response after one injection. On occasion, repeat injections are needed if a patient hasn't had a full response, but in my personal experience, that's been pretty rare.
Dr. Brand, typically after you have an injection of PRP, how soon can you return to activity, or is there a protocol?
So we have a rehab protocol that's several weeks long that takes patients through the stages of rehabilitation and return to sport. So generally, there will be a period of about 2 weeks in which you will want to recover from the healing inflammatory response that we've caused. And then in about 2 weeks, we get people into physical therapy, and I'll see people back in clinic at about 1 month after the injection. Now, I wouldn't expect the full benefits of the injection to kick in until about 8 weeks. So that's the point at which I judge the full efficacy of the procedure.
So it's a pretty, as far as procedures go, my understanding is it's a pretty simple procedure, and you're getting good results. And if someone was interested in getting more information, how would they contact your office?
They can get a hold of our office at our website, which is www.rehabissaquah.com, or they can call us directly at 425-394-1200.
Great. Thank you for your time.
Thank you.
Thank you very much.
If you would like more information on this topic, as well as how to contact Dr. Eric Brand and Dr. Kevin Berry, go to rehabissaquah.com or irgpt.com and click on the Health Experts tab.